A 15-year-old boy is brought to the clinic because he has had difficulty running and climbing stairs. He has had progressive muscle weakness since childhood, but was able to meet developmental milestones. On physical examination, the physician finds that the patient's calf muscles are enlarged and feels soft and rubbery on palpation. Creatine kinase is elevated. Genetic testing reveals that the patient has an error in RNA synthesis where a small section of the regular protein is improperly removed, resulting in an impaired but still functional protein. Which of the following best describe the abnormality in this patient? Choice A, absence of a non-coding section of DNA that allows RNA polymerase II to attach. Choice B, lack of addition of methylguanosine to stabilize RNA. Choice C, error in poly-A polymerase function which protects RNA from degradation. Choice D, deletion of a single nucleotide disrupting the reading frame. Or choice E, disruption of normal sites of spliceosome function. I'll wait 5 seconds and then answer the question. So this is one of those annoying questions that's focused on the biochemistry, especially the RNA processing. The fact that this patient most likely has Becker muscular dystrophy is actually just a bonus point. You don't need it to be able to answer the question, but I did throw it in here because you should still know what Duchenne's and Becker's looks like. It's an X-linked recessive condition, and of course it presents with this progressive muscle weakness and this calf pseudohypertrophy. Just for a couple bonus points, you need to know that Duchenne/Becker's is a mutation in the dystrophin gene, which helps to link the cytoskeleton to the extracellular matrix. And the reason you know that this is probably Becker's instead of Duchenne's, because aside from the fact that I just straight up told you that the protein is impaired but still functional, it's the fact that this is a 15-year-old boy. Usually Duchenne's is going to present way earlier than that, and it's probably going to sound more severe as well. But anyway, like I said, this is a question more focused on the RNA processing biochemistry aspect of the question. So we are told that a small section of the regular protein is improperly removed, which is to say an exon is improperly removed, which is one of the ways that Becker can happen, which is where you remove a part of the protein, but it's still functional because most of it is still there. And this can happen for various reasons, but typically it's because there's a new splicing site found for the spliceosome to exert its function on. So choice E, disruption of normal sites of spliceosome function, is the correct answer. Now, the biochemistry aspect of this is always very annoying because you kind of have to know the entire process. Otherwise, you run the risk of getting questions like this wrong because you might get confused. So let's just run through that real quick, okay? In order for RNA to be synthesized, of course, you need RNA polymerase II to attach to DNA. You do, in fact, need to know that it's RNA polymerase II that does this and not one of the other RNA polymerases. So anyway, you first attach to a promoter region, most commonly a Tata box. And yes, you need to specifically know that because they have questions where they give you a section of DNA. They'll say like, oh, a section of DNA that normally says CATAAAA is disrupted. What happened? And one thing to note about this is that a Tata box isn't always only adenine and thymine, despite the name. Sometimes there's going to be guanines and cytosines in there somewhere, but they'll usually make it fairly obvious that it's a Tata box because it'll look like a Tata box. It's hard for me to explain exactly what that looks like, but you kind of have to use a bit of intuition here. And you need to know that if the Tata box is disrupted, then transcription in general is disrupted, right? Because if I can't attach RNA polymerase II to the promoter region, then I can't start transcription in the first place. You also need to know that the promoter region usually sits in front or before the actual translator region of the DNA, usually like 20 or 30 base pairs up. Anyway, here I didn't mention anything about the Tata box. I didn't mention that transcription itself was disrupted, so that's why we know choice A, absence of a non-coding section of DNA that allows RNA polymerase II to attach, is incorrect. Okay, so after RNA polymerase II attaches alongside some other transcription factors, then actual transcription can begin. RNA transcription happens in the 5' to 3' direction, and when the 5' quote-unquote head is finished being transcripted, very soon after, it is going to attach a 7-methylguanosine, which is choice B here. The methylguanosine cap mainly helps to stabilize RNA and prevent it from being broken down. So if there is a disruption here, it would be more about me saying something like the RNA breaks down easily. And similarly, choice C is what happens at the tail end of the RNA, right? The 3' end has poly A polymerase forming a poly A tail. And both this 5' cap and this 3' poly A tail are used to help stabilize the RNA. And of course, as mentioned, during RNA processing, we also cut out the introns using a spliceosome, which is composed of SNRMPs or SNRPs. And then you join the exons together to form the final RNA that can be transported out of the nucleus. And just as a side note, the introns aren't necessarily non-coding sections of the DNA or RNA, because there's this thing called alternative splicing, where I can cut apart the RNA in different ways and end up with different exons. So the main point I want you to take away from this is that you kind of have to make sure you remember which parts of RNA processing are which, because you don't want to get a question like this and you start mixing them up and you'll get the question wrong. So just remember, when I finish transcripting a RNA, I'm going to add to the 5' head. It's going to be a methylguanosine cap. And then at the tail end, the 3' end, I'm going to add a poly A tail. And in the middle, I'm going to cut out the introns and then splice the exons together using a spliceosome, which is also consisting of SNRPs. And of course, also know that the promoter region for RNA polymerase 2 is what allows transcription to start in the first place. I hope you found this video helpful. I'll see you in the next one.